a PT here. I've probably seen most of you, or you've seen me in the clinic, so you know me pretty well. So first we're going to go through some facts about falls. More than 1/4 of Americans age 65 and over fall each year. So raise your hand if you're over 65. Yeah, so there's probably about 20 of you in here that are at risk there. Falls are the leading cause of injuries and injury-related deaths in Iowa. More than 3 million injuries treated in the emergency departments annually are due to falls, including over 800,000 hospitalizations. So you've probably all known somebody that has been hospitalized due to a fall as well. It's very prevalent. One of the biggest causes of a hip fracture is falling. More than 95% of the hip fractures are caused by falling, and usually due to falling sideways. Falling is also a major cause of traumatic brain injury. So falling, hitting your head on a step or a fireplace or the wall, something like that. Very common. Another fun fact is people with mild hearing loss are about 3 times more likely to fall. And your fall risk increases with every 10 decibels of hearing loss. So who can't hear me? Yeah, you're probably at a higher risk for falls.
Why?
We'll get into that in a little bit. Sorry, that's just a little prelude. 60% of falls happen in the home, 30% happen in a public setting, and 10% happen in a healthcare center. Another huge issue is the fear of falling. So if you have a fear of falling, that's going to prevent you from wanting to do certain activities or certain activities that you're used to. So if you're not going to church because you're afraid of falling on the step, if you're not, going to your exercise class, if you're not doing your normal routine, you're gonna stay at home, you're gonna get complacent and sedentary, your muscles are gonna waste away, you're gonna get weaker, weakness leads to falling. So there's different ways we can help prevent that. Here's some data that Jesse compiled for us at ORHC. From January of this year to July, the fall-related causes of injury was 37% for inpatients in the hospital here, and remaining injuries, which was a wide variety, was about 63%. So disposition, where were they discharged after their falls? 84% discharged to home, and 16% were transferred for higher level of care. So now you're asking yourself, how can I prevent falls? That's probably why you're here. So the first thing, stay physically active. Like I said, you don't want to have that fear fall where you're not doing your typical activities, right? So stay physically active. Join a walking team, or go to your church and walk in the hallways for an extended period of time, building your tolerance up as you get better. Participate in an exercise class. So they have silver sneakers here twice a week. So that's a good way to stay active. And she's able to modify based on your necessarily physical levels and safety. Perform an indoor walking program. And then physical therapy. So talk to if you're concerned about it, talk to your physician about maybe doing some physical therapy. There's a lot we can do. What I say is there's 3 systems that are in charge of your balance. The first one is your muscles and your joints. They have special sensors that send signals to your brain, okay? So if you're leaning forward, the sensors in your calf muscles relay information to correct your posture, return you to an upright position. There's a bunch of different ways that your muscles and joints can help you. Flexibility, that's another big issue. If your hips are super stiff, and then you're just ending up like a board, and you tumble forward, right? Otherwise, you need flexible hips to correct your posture and bring it back upright. Flexible spine. If you're leaning backward, you need the reflex and the flexibility to catch yourself with your leg and keep you from falling backwards. So flexibility is a huge issue. The second system is your vision. People rely on vision in order to notice obstacles in the environment. If it's a rough terrain, being able to see that there's a change in slope. If a dog comes running in front of you, knowing where it's going to be so you don't run into it, or the dog runs into you. And then the third thing is the vestibular system. So there's a complex system within your inner ear that senses head movement. Okay, so if your head turns this way, there's a system that tells your head it's going that way, and reflexes to your eyes and keeps you from getting lightheaded or dizzy. Looking up, same thing. Who gets dizzy when you look up to reach into a cabinet, right? It almost makes you fall backwards. So there's a system in your ear that is in charge of that and helps you correct it. So if any of those systems are impaired, physical therapy can help you treat that and improve that, or strengthen that. So another thing I say, you go to a weight room to get stronger, right? You go from 5 pounds to 10 pounds to 15 pounds, and you get stronger that way. So there's a certain series of exercises that we can help strengthen your balance. Okay, it doesn't appear like you're increasing from 5 to 10 to 15 pounds, but it's small changes. So starting by having your feet spread apart and then putting them together, that decreases your balance or your base of support, kind of makes your balance system work harder. And then going toe in front of the other, that also increases the difficulty of balance. And then if you can, you stand on one leg. So then we can also decipher which system is kind of your main issue, right? So if I took everybody in here, I would probably prescribe different exercises based on your individual needs. Okay, what system is limiting your balance? So if you're pretty stable, standing on your feet here, I might put you on this fun pad. It's called an RX pad. People generally don't like it, but that takes away makes it feel like you're on an uneven surface, right? So that takes away those sensors in your muscles and joints, and makes the other two systems work harder, your eyes and your ears. Okay, so that increases the difficulty or challenge to those systems. So then when you're up here, we can also make it more challenging by closing your eyes. Okay, so now your vestibular system is the primary focus of balance. Okay, so who gets dizzy when you're in church and they say, let's close your eyes and pray, and then you stand up and then you're wobbling back and forth, right? That's because of those systems. Fun stuff, just riveting. All right, so other external factors that you can modify to help decrease your risk for falls is your shoes. So wearing non-skid, rubber-soled, and low-heeled shoes. Okay, get rid of those wedges or high heels. I had to do that the other day. So. Wear lace-up shoes with non-skid soles, and then use your assistive device. Okay, they're there for a reason, right? It's to keep you upright. People are afraid that they're going to become dependent on the walker or the cane, right? But if you have it, you need it, right? It's going to keep you on your feet. If you say, I can walk that far without using it, and then you end up falling, break your hip, then you're in quite a predicament, and it's going to be a longer road for you. and harder to get back to a point where you don't need a walker. Same thing with, even sitting in a chair. If there's a chair over here and you use your walker, you put it over here, and then you walk this short distance, that's a good risk for falls too. Okay? You're pivoting, you're turning at the same time. There's a good chance you're going to end up on the ground. So don't do it. Some home modifications that you can do. So outside of your bathtub or within the bathtub, outside of the shower, putting a non-skid, non-slip mat. Using night lights. Another huge risk is when you get up in the middle of the night to go to the bathroom. Okay? It's dark. So when it's dark, your eyes, it's kind of like you're closing your eyes. Okay? It makes the other two systems work harder. And as you age, you rely on your vision even more for your balance. So that's another huge issue is dimly lit rooms. Okay? So use those night lights, help you light your path to the bathroom. And then make sure you have clear paths to light switches, or you can add illuminated light switches. Those are a good help. Because if you have to, lean over a box in order to flip off a switch, you got a good chance of losing your balance because your base of support is outside. You can add a raised toilet seat to make the getting up and down from a toilet easier. Using safety frames or armrests on the toilet to help push off, or putting grab bars next to the toilet or in the shower, because in the shower is also another big area where falls happen. Using a shower chair or different assistive devices, or something that Andrea with occupational therapy is more knowledgeable on. Okay, home hazards. Making sure you remove any cords or lines that might be present in the house that you could trip on. Any loose rugs. Okay, when you have loose rugs, they have a tendency to ravel up or have a little bump in it. It's hard to clear your toe. When your toe gets caught, you tumble forward. So get rid of those throw rugs. Okay. Any kind of boxes that might be in the way, like I said, reaching over them. Throw off your balance. And spilt liquids, okay? Happened a couple times where, an ice cube fell out of the refrigerator tray. People didn't see it, melted, they're walking through the hallway, flip on the ice, or on the melted ice cube, so the water. So make sure you clean it up right away, any kind of spilt liquids. Okay, so having your eyes and hearing tested. Like I said, as you age, you rely more on your vision. So make sure you get your prescription updated, go to the eye doctor so that you can see everything in your path, and improve those deficits. The other thing is having your hearing tested, right? So, with a mild degree of hearing loss, it triples the risk of an accidental fall. This risk increases by 140% for every additional 10 decibels of hearing loss. So if you have hearing loss, you're less aware of your environment. You don't notice pets or other people or activities that might be going on around. You have decreased spatial awareness. So you have difficulty gauging where your body is in relation to objects around you. And lastly, with hearing loss, your brain relies more on hearing and interpreting other speech or noises around you, and you have less resources available to concentrating on your balance and walking, right? So you're distracted in the environment by a certain noise. This just happened to my grandmother-in-law the other day at our house. She wanted to get into our shed to look at a tractor. the machine shed doors were open and my friend was closing it. As she's stepping over the little threshold, she says stop in the middle of stepping over the threshold, clips her toe on the threshold and goes down. So luckily she wasn't injured too bad, but yeah, hearing tested, eyes, use your assistive device. I've told her many times to use it, but yeah, in one ear, out the other. And then also getting a regular physical examination. Going to the doctor, they'll also help you determine if you need some physical therapy or if there's other issues, medical issues that you need to be aware of or seek treatment for. Yeah. Some safety tips. Stand up slowly and get your bearings, okay? So like I said, the doctor can also help you with this. If you have a blood pressure issue where your blood pressure drops after changing position, so typically from going from a chair to standing up, the blood pressure has to pick up a little bit in order to keep the blood rushing to your head. If it doesn't, you get lightheaded, and then you get woozy, and you can have a fall. So if this happens to you, make sure you go slow. Get your bearings. If you can't get your bearings, try to sit back down and kind of collect yourself, right? Otherwise, seek treatment for that. Take your time. And then be careful when you're walking on ice or snowy surfaces. With winter just around the corner, that's a big thing. Watch out for the ice. If what we say is walk like a penguin, right? Wide base of support, toes out a little bit, short steps. Increase your base of support, okay? Now we don't want you to walk like that 24/7. You'll have other issues. And then keep your hands free. So your hands kind of help with your balance too, kind of like a tightrope walker. Keep your hands free. Any questions?
Do you have any tips on getting in and out of the bathtub?
So is it a tub shower?
No.
No, a regular walk-in shower with a little threshold?
No walk-in shower, just a tub with I have a grab bar.
Yeah,
But
grab
getting
bar.
up and down.
Andrea is with occupational therapy. She can really teach you about that. She's back there. But yeah, a grab bar, or if you need a shower chair, that's a good option.
Revamp your bathroom.
Revamp your bathroom. You've got the...
I like a bath though.
So getting up from lying down, is that what you're talking about? Or getting into
Or
the...
just getting in, so be careful. I think I
Yeah.
am, but I thought maybe you had another.
The grab bars. Grab bars is probably the best way to keep you upright. Yes, Carrie.
So you demonstrated how not to sit down if you have a device with you. Can you demonstrate how you would use the device to sit in the chair?
You bet. Okay, so you got a chair available.
I got my tummy.
Beautiful. Lovely assistant, Andrea. Yeah, applause. Yeah. Okay, so if you do have the walker and you're going to sit in a chair, make sure you back up to it so the back of your knees can feel the chair. Reach back for the armrest and then sit down. Okay, keeping the walker right there because when you get up, you're going to need it right there as well, right? If it's over here, you stand up and then you have to walk over this way. Once again, that's a short distance, but higher risk of fall because you're turning and your balance is already impaired. So keep it right there, stand up, and you're on your way. Great question, Carrie, thank you. Wendy.
So spinning off of that, and when you're getting up, can you talk about the importance of pushing up from the chair and not grabbing
Yes, so this chair is sturdy. It's got 4 legs, right? That's beautiful. It's got a nice supportive system. Your walker is not so stable, right? Shakes. Okay, so which one is going to help you get up? The chair. Yeah, so push up from the chair instead of reaching up here. Okay? Better force production. I could go into the physics of it if you want, but I don't have any charts. Yes, Denise.
So I've fallen,
And you can't get up.
what do I do to get up?
Another good thing is to have the life alert, right? So get those. That's number one. Okay. If you notice, if you've fallen and you can't get up, and your foot is facing a way it shouldn't, you shouldn't move, right? You should. Hopefully, you've got your phone nearby, or somebody is available. Call for help. If you're feeling okay, I've fallen, but I'm not hurt too bad. It's a tricky situation, but try to crawl over to a chair or a supportive surface, couch. Crawl over to it. Right, get on one knee, and then you can push yourself up if you're strong enough. Otherwise, you're probably going to need some assistance. Any other?
But if
Except with falls, that most people fall sideways and break a hip. If you're feeling that you're gonna fall, what should you do? Try and fall flat on your face or flat on your back?
Yeah, that's a good question. You don't want to really reach out your hand because you can brace the hand too or the shoulder. You do kind of want to fall sideways, I would say. You don't want to fall backwards because you're going to have you're going to hit your head. And a lot of times you're not going to be able to prevent it, right? But trying to, if you can slow yourself down, obviously that's best. But going on one knee and then down to the hip and slowly make your way down to the earth. Any other mind-blowing questions?
But you know, if you've had knee surgery, and then you try to get up, use your knee, it about kills you.
It does. So that's why you should take the preventative measures and not fall. Do I need to start the presentation over? Yes, go ahead.
Are there any exercises that can be done at home to improve balance?
And like I said, there's one person versus another person in here is going to have a totally different home exercise program that we would prescribe. So depending on your needs, maybe it's just general strength. That would be totally different from if your balance is impaired or if you have an inner ear issue. So if you don't have any significant health issues, a walking program is a good way to start. I'd say walking is the best thing that anybody can do at any age. So that's a good place to start. Slowly building up your strength, your endurance. But otherwise, asking your physician if physical therapy is right for you, and then we can help you get what you need. I can't just sit here and tell you, oh, you need to do 15 sit-to-stands, you need to do 10 step-ups, hip extension, hip abduction, etc. Carrie.
How do I know, with my symptoms, when is a good time to contact my provider? And can I just come see you, or do I need to see my doctor first?
Yes, here at ORHC, you need a physician's referral. So I would say if you're even thinking about it or thinking you have an issue, I would go to the physician right away. Better to get checked out before you have an issue, to a point where you're sitting on the floor with your total knee replacements and you can't get up. Once again, preventative. So. Exercise is great for the body, regardless of if you have a fall risk or not. Yes, Yvonne.
I I think the best thing that has happened with me, I fall a lot, as you might know, but, is don't panic. If you fall and do it right away, don't think you're gonna be there for a long time. I've had to learn to think it through and find something that's close enough to me that, especially if I'm on my back, I have to learn how to roll over and everything, and be able to find something that's going to help me get up and everything, so. Try not to panic. I've fallen so many times, I don't panic anymore, I just
Yeah.
try to think.
Feels weird if you're not on the ground.
Now, are most falls related to high mileage or getting older?
Yeah, like that stat showed, 95, or what was it? More than 1/4 of Americans aged 65 and over fall each year. So, as you get old, once again you retire. You're not physically active as you were when you were maybe working. So your muscles deteriorate. Your joints are less flexible, like I said. Everything kind of. Every 5 years, you're like, wait, I can't do that anymore, right? I'm 34 and dream and wish that I was 30 again. So,
Well, I took a tumble backwards down the basement steps, and it just happened so fast, I didn't know what was going on. Until my head hit the cement on the bottom. But,
so not
I
what
did
say.
get myself up. It's just something that happened so fast, you couldn't react.
Mhm. Yeah, and there's not obviously if you could do something to prevent the fall from happening, you would. And it just happens so quick that you can't do anything about it. You can practice ninja skills in the garage.
Well, it helped to, coming over there. It does help to have railing on both sides of your
Yep.
stairs.
Use railing, grab bars, all those things to help.
Even at that, I used both railings, and when I got top, when I stood up, I went over backwards.
Yeah, don't fall
Scary.
backwards. Abigail.
What if I had a fall and hit my head, went to the doctor, and the doctor said I had a concussion? Would physical therapy be able to help me?
Yes. Little known fact that physical therapy can help with concussions. Once again, you'd have to get referred from your physician, but there's a lot of different things we can do for concussion management, whether you have headaches, whether you have difficulty concentrating or just neck pain. There's a wide range of symptoms that we can actually treat with physical therapy. Inner ear issue that can be a result of a concussion. Arlene.
Don't overcarry stuff, make 2 trips.
Yeah. Keep those hands free as possible. Because if you make multiple trips, you're also getting more walking and building up strength and endurance.
If you can't see over what you're
Carry.
carrying,
Go for it.
So I'm a younger person. I'm
Obviously.
Hypothetically, I'm a younger person, say I'm in my 20s, 30s, and I have a lot of trouble with vertigo. Can physical therapy help me with vertigo?
We can help with vertigo. Once again, that's part of that inner ear system. So there's a bunch of different pathologies or issues that can be present within the inner ear that we can work on. So if you have any dizziness or lightheadedness, that's another pathology that we can treat in physical therapy. Yes.
How do you go about getting a diagnosis if you got vertigo?
If you have vertigo,
Yeah, do you, cause I don't think doctors check that very well.
so, and it depends on the severity. Vestibular impairments, you can specialize in that and you can treat that all day long if you have as much training as needed. There's a bunch of different things that they can look into. Now, there's different tests that they do where they put you in different positions or have you focus on objects in different ways that, depending on how your eyes twitch, will tell them different things. So there's a it's a very complicated and sophisticated system.
But should you ask them to check that?
Yeah. Yeah, if you have any concerns about your
They
dizziness.
don't normally check it, right?
Yeah, yeah, and if they don't know about it, then they wouldn't necessarily check into it. So you just gotta tell them all your symptoms.
And I feel that medications have a big part, some
Yes.
medications with the dizziness.
Yeah, that's once again, talk to your pharmacist, your physician about medication. There's a bunch of different interactions that can happen, that's out of my scope, and I don't deal with. Didn't go to school long enough for that. But yeah, talk to somebody with a bigger brain. Ringing in the ears. Once again, depends on the cause. You know, if it's tinnitus, there's not a lot, but if it's caused by a different issue, it's worth a shot.
Nerve issue?
What's that?
Is that connected to a nerve doing that?
It might be. Yeah, talk to your physician.
Yeah, medication will do that. I have that.
Yep. Yep.
For
They can put
diabetes,
some
ringing in the ear.
medication for it.
Yeah.
Todd, anything? No? All right. Anything else?
I just wanna say, you mentioned Silver Sneakers, but it really is a good program and for balance, I mean,
Mhm.
really, it helps.
Yes.
So, it's-
I would highly recommend going to Silver Sneakers. You know, if you're not confident in your abilities quite yet, we can work with physical therapy first to develop some strength and mobility in order for you to progress to Silver Sneakers. But it's a great program. And you just socialize a lot too, right? That's huge. No, social partying is great. When? When is Silver Sneakers?
It's, right now it's on Tuesday and Thursday from 9 until about 9:45.
Tuesdays, Thursdays from 9 to 9:45.
And you don't have to be a member of the wellness center, you can get a punch card.
Okay. You can get a punch card. Did everybody hear that?
It's $3 a class.
$3 per punch?
Yep.
Okay. Anything else? All right. Thank you all for coming and questions.